All right, the last segment I have for you, Pete, is before you go. And this is when we ask a doctor to give us your opinion on the best little advice you can give these patients before they go to a doctor. So, what do you think?
Well, I think there's a lot of different things that you should be thinking about, but most importantly, you should be trying to get as much information about why you came to the doctor and what you're asking, what your problem is as possible. The problem is you're thinking of a lot of different things and you're trying to not only explain your problem, but then you're trying to learn about your problem. And so there's no possible way you can in 10 or 15 minutes get all the information you need. Um, Oftentimes, I'm sure this is the case, and I try to repeat myself a lot in my office, but I'm sure there's things I don't repeat, and I think it's always helpful if you're a patient and you have a question, or you think you heard something, or you're not sure what you heard, or if you have a question that wasn't answered, to ask the question, either to repeat something or to clarify something. And we learn this to do the same thing with our patients, but if it isn't being done for you by your doctor, to put things back in your words to the doctor and have the doctor, clarify what your understanding might be, because that's ultimately what you get out of the doctor's visit is information, if nothing else. And so if you can't walk away with useful information about what you were there for, then the visit is a failure, or it's incomplete. So you want to make sure that you get as much value out of that visit as possible.
Right.
It's your time, it's your money, and you need to make sure that information transmits.
Right. I know, like when I go, I have some anxiety, especially if it's something serious, and I'm listening to the doctor tell me what's going on,
Right.
and I'm shaking my head yes, but I'm not really
No.
soaking up the information. So I get what you're saying. Make sure you ask the question again. As a patient, if you don't know, you're not really picking up on the answer, maybe ask them to explain it in another way. Because
Yep.
I think some patients, including myself, we get a little intimidated because we don't want to say, "Hey, we don't really understand what you're saying.
Right.
Can you can you say it in another way?" That's going to
Yeah.
help me.
And I think oftentimes doctors they come in, they leave. You almost don't want to interrupt them, but that's your time
Yeah,
as the patient.
yeah,
So you have the right to ask the questions, clarify the questions that you may have, clarify the information that you think you heard,
slow them down if you need.
slow
Right?
them down if you need to,
Yeah,
um, and ultimately it'll prevent unnecessary follow-up visits because you'll totally understand what happened the first time, and you'll be totally on board with what the next steps are going to be. Um, I like to, in my office, I like to write or draw pictures of things, structures, like, whether it's trigger finger, carpal tunnel, fracture, different things,
yeah.
so that people
Visual.
yeah, some people
Yeah,
do better visually. I know
sure.
I do.
Yeah,
So hopefully that helps. Um, but if that's not being done for you, ask the question, repeat, or don't be afraid to ask someone to repeat, a doctor to repeat what they said.
all right.